This is Chapter 9, Diseases and Conditions of the Respiratory System. And as usual, the first thing you should do is review the parts of the respiratory system. And you can do that with an anatomy book or with your, probably your medical terminology book if you've used language medicine. And your Chapter 9 of the Essentials of Human Diseases and Conditions has a good review of what they title the orderly function of the respiratory system. These are the 6 conditions that we will not be covering, that you will not be tested on for Chapter 9. I want to start out with some description of diagnostic procedures. These are procedures used to determine pathology of the respiratory system, to determine if someone has a particular condition or disease and what that condition or disease is. I want to look first at blood gas analysis. Blood gas analysis. Now, most of you would be familiar with having given a sample of blood for a test to be performed on, and usually the puncture's made in the bend of your arm, and they're puncturing a vein, and they're taking out the blood from the vein to do various tests on. This particular test, it's not the vein that is punctured, it is the artery. And they usually take the sample of blood from the wrist area, and someone that's very highly trained will actually puncture an artery to remove just a small sample of blood from the artery to measure the blood gases. This is also referred to by the abbreviation ABG, arterial blood gas. These are arterial blood gas studies used to assess the adequacy of pulmonary gas exchange, oxygen and carbon dioxide, in persons with respiratory or circulatory disease. So to assess the adequacy of pulmonary gas exchange, in a normally functioning respiratory system, the person breathes in the air that contains a certain amount of oxygen, and the gas exchange actually takes place in the alveoli of the lungs. And the gas exchange is that the blood capillaries there will pick up the oxygen to carry the oxygen to all parts of the body at the same time that the carbon dioxide is left off in the lungs so that you can breathe out the carbon dioxide. So that's what should normally happen, is that you breathe in the oxygen, you breathe out carbon dioxide, and the gas exchange should take place so that you're getting plenty of oxygen into your arteries and the carbon dioxide is being left off. There's a number of different problems that could cause abnormal arterial blood gases. I want you to look in your Appendix 1 of your textbook. This is a really good appendix that you should probably mark with a tab or something so that you could go back and use this later as a reference. I want to say especially those students in health information technology, medical coding, and even medical transcription. This is a wonderful description of common laboratory and diagnostic tests. And what you see is a description of the arterial blood gas analysis and the normal adult values. And also in this same section of the book, they describe some of the conditions that a person may have that would cause the arterial blood gas analysis to be abnormal. So you may hear me reference the arterial blood gases a little bit later. And now you know a little bit about what they are, and you know where in your book you need to study about arterial blood gas analysis. All right, under radiography, I feel sure you know what a chest x-ray is. I've provided a picture on your screen of a chest x-ray and how the lungs can be visualized there. It's called an imaging procedure. Most of our radiography procedures are now referred to as imaging because you get an image of the human body and the inside. In this case, we're looking at the lungs. CAT scans are also commonly performed on the chest area to assess the lungs. In the CAT scan, they still use x-rays, but they take a series of x-ray images in order to almost see a 3D type image of the inside of the person's body. I want you to, again, you're in Appendix 1. I want you to look at page 781, computerized tomography scans. There's a good description there of the CAT scans. Okay, we should look also at MRI while you're on this page. Magnetic resonance imaging uses a magnetic field instead of radiation to visualize the internal tissues. This again provides more of a three-dimensional view and really provides good image of soft tissues. The MRI will also help in determining the blood flow to the tissues and the organs. And there is no exposure to radiation during the MRI. But a patient that has any type of metal in their body, caution has to be taken because it's a magnet and it may displace the metal in the person's teeth, or if they have metal plates or screws in their bones because they've had some kind of serious fracture and had to have an internal fixation there. Bronchoscopy, a couple of pages over in our Appendix 1 under endoscopy test. Bronchoscopy, visualization of the trachea and bronchi with the bronchoscope. Normally when the bronchoscopy is performed, the physician will begin looking at the nasopharynx area, kind of the back of the throat, and down into the larynx, the trachea, and the bronchi. And this can be done to look for abnormalities like tumors, and if a tumor is located or a lesion, then a biopsy can be taken using the scope. The sputum exam and culture. On this same page under pulmonary function studies, it said same page, it's page 785, pulmonary function studies, sputum studies, analysis and cultures of sputum, and they describe what sputum is in case you don't know, material expelled from the respiratory tract, things that you cough up. Sputum studies are analyses and cultures of sputum to detect the presence of pathogens. So a person will cough up some of this material from the respiratory tract, and that material will be studied, and if any bacteria are located there, they'll be cultured, they'll grow the bacteria, and then usually the sputum culture includes a sensitivity test in which the in which the lab technician will use various antibiotics to determine if the organism, the bacteria, is sensitive to those antibiotics. When a sputum culture and sensitivity test is performed, whichever antibiotics the bacteria are sensitive to can be used to destroy those bacteria. At the same time, they find which antibiotics the organisms are resistant to. If the organisms are resistant then those antibiotics are not going to work in destroying and controlling that infection. A underpulmonary function test. Several are listed here, like the pulse oximeter, in which the person wears the oximeter on the end of their finger, and it indicates the oxygen saturation. The hope is that it's 95% or greater. Spirometry, a measurement of lung capacity, volume, and flow rates, used in evaluation of asthma, bronchitis, COPD, emphysema. Okay, the first condition we're going to talk about, back over to Chapter 9. Before we get too far into the conditions, I want you to look at information about the chief symptoms indicating respiratory tract disorders. Chest pain, which could be an indication that the person has pneumonia or bronchitis. Dyspnea is the medical term for difficulty in breathing. If a person is coughing and they're actually coughing stuff up, a productive cough is an indication of some abnormal condition. Hemoptysis is the coughing up of blood, which could indicate certain forms of pneumonia, but also could indicate tuberculosis. Dysphonia is hoarseness, difficulty with voice. A person that has pneumonia or some infection of the respiratory tract may have fever and chills. Or there are times also with respiratory conditions the person will have a low-grade fever. Wheezing is a very common symptom to conditions like asthma and some of the other COPDs like emphysema. I said COPDs, chronic obstructive pulmonary diseases, and I'll get to those details of that condition in just a few minutes. First, I want to go through, kind of following through with the order in your book, looking at the common cold and other upper respiratory infections. When we're looking at upper respiratory tract, we're talking about from the throat up. Your nose and nasal cavities, nasal sinuses, the back of your throat, the pharynx are all considered part of the upper respiratory tract, and the larynx. URI, common abbreviation for upper respiratory infection. When someone has an upper respiratory infection, they have acute inflammation affecting the mucous membranes that line this upper respiratory tract. They'll usually have nasal congestion or a runny nose or sneezing, watering eyes, sore throat, perhaps hoarseness and coughing. Very often the upper respiratory infection will be caused by a virus and be the common cold. There are certain environmental conditions or factors that lower a person's resistance to the highly contagious cold-causing viruses. When you look under etiology, the common cold is a group of minor illnesses that can be caused by almost 200 different viruses. There are many, many different viruses that may result in the common cold. Rhinoviruses cause about 1/2 of the colds in adults. And they point out that some of the colds result from mycoplasma and other atypical organisms. It may be a bacteria, it may be a virus, it may be what we refer to as mycoplasmas. And many of these organisms are spread by droplets in the air when people cough and sneeze. Even though the common cold is caused by a virus or one of these other named mycoplasma, bacteria may come in as secondary invaders. After the person has the infection with the virus, their system is weakened and the bacteria come in and make the person even sicker, and may even, the condition may progress to pneumonia because of the secondary invaders. There's no cure for the common cold. The treatment is just symptomatic, helping the person to rest and drink plenty of fluids is important. Over-the-counter cold tablets may be effective, cough syrups, analgesics for the fever, whether it's ibuprofen or acetaminophen or aspirin. Now there is information in your book, a note that aspirin is contraindicated for infants and children. Infants and children are not supposed to take aspirin. Not until a person's age 18 should they be given aspirin, unless it's a physician under a physician's care. Sinusitis, another upper respiratory infection that affects the mucous membranes of the sinuses. And hopefully you know that the sinus cavities are kind of behind the facial bones, in the forehead and the cheeks and the nose. You've got frontal sinuses, maxillary sinuses, and those are the two that are most affected by inflammation. When the person has a frontal sinusitis, they'll have a very distinct frontal headache over one or both eyes, especially in the morning. Pain and tenderness above the eyes. The pain in the cheeks and in the teeth will indicate more likely a maxillary sinusitis. Fever is usually present. And treatment is about improving drainage, taking decongestants. If it is bacterial, if the pus, or I shouldn't say that, the mucus is more yellow or green, purulent material, then it's probably bacterial and the person needs to be treated with some antibiotics. The diagnosis is usually made just by the person's complaints, what's called the clinical picture, the way the patient looks on exam, and what the patient's saying. But x-rays may also be taken that will show the sinuses and show the degree of sinusitis there. Under disorders of the throat, we're still talking about upper respiratory infection conditions. Pharyngitis is inflammation of the throat, which when the throat's inflamed, there's going to be redness, there's going to be pain. So the person will have some sore throat, dysphagia, difficulty swallowing. If chills and fever are present, then there's a good chance that it's caused by bacteria like strep, and the person needs to have a culture, where they kind of gag you with the Q-tip. It's not exactly what it's called, but they use a Q-tip type structure. I didn't say that just right. They use a very long Q-tip-like instrument to remove a portion of the pus from the back of the throat, and then they perform a culture and sensitivity to determine what is causing the pharyngitis, what type of bacteria. If it's strep or other bacteria, a broad-spectrum antibiotic is usually required. And very important, if it is a strep pharyngitis, it's very important to have that strep treated early. And when the person is treated, they have to take all of the antibiotics that the physician prescribes. There is a danger that if the person has strep throat that's incompletely treated or not treated at all, they may go on to develop rheumatic fever. So it's, again, very important to take the antibiotics to know when strep is being dealt with. There are some other systemic viral infections that may cause pharyngitis, such as chickenpox and measles. So the treatment of pharyngitis is all about what the cause is. Saltwater gargles are recommended. Ice is sometimes helpful. Aspirin again, but being cautious about giving aspirin to children. And then laryngitis. Under laryngitis, it's inflammation of the larynx, including the vocal cords, which causes a person to have difficulty with their voice and have hoarseness, which is referred to as dysphonia. If they completely lose their voice, it's aphonia. A is without, dis is difficulty. Either way, the person's going to have difficulty and maybe unable to talk at all. A lot of different causes for laryngitis. It could be just that the person has used their vocal cords too much, maybe attended a ball game and did a lot of hollering there and strained their vocal cords, or it could truly be a viral laryngitis or bacterial. If it's bacterial, antibiotics will be successful, should be successful in treating. Laryngitis will also occur along with other diseases like bronchitis, mononucleosis, pneumonia, even syphilis, tuberculosis. Occasionally laryngitis is caused, again, just by an irritation without infection. Now, the laryngitis could also be due to acid reflux. In teaching about the digestive system, I teach about GERD, gastroesophageal reflux disease, that may result in laryngitis because of the constant acid reflux. Irritating materials, irritating factors in the environment, smoke or smog may cause the person to develop laryngitis. So treatment is all about what's causing the laryngitis, and the best treatment is rest of the voice. And then avoiding any known irritants if it is due to cigarette smoke. Okay, now I want you to look at nasopharyngeal carcinoma. Nasopharyngeal carcinoma, this is a cancer in the area of the pharynx that opens into the nasal cavity. And remember, the pharynx is the throat. So it's the back of the throat more towards the nose. This is the only type of cancer of the head and neck, or especially the respiratory tract, that is not strongly linked to tobacco use. Any other form of carcinoma of the respiratory tract, it's probably due to the person's use and abuse of tobacco, and maybe even secondhand smoke. The link for nasopharyngeal carcinoma has been to a virus called Epstein-Barr virus. And within the system, I'll be talking about mononucleosis. And mononucleosis is caused by this Epstein-Barr virus. In some people that have had mononucleosis in an early stage in life, later, much later in life, they may develop a carcinoma associated with Epstein-Barr. If a person has cancer of the nasopharynx, it's asymptomatic. They don't realize they have the cancer until much later, and the cancer has advanced. Then they may detect a neck mass, or they may have obstruction of the nasal area because of the mass. They may also experience epistaxis or have problems with inflammation in the ears due to nasopharyngeal cancer. Treatment, it's very difficult to do surgery in this particular area, so it usually depends on the surgery. The treatment includes radiation, sometimes radiation and chemotherapy if the cancer is advanced. And of course, a biopsy of any mass in that area has to be performed to confirm the presence of cancer. I'm going to skip over a couple of conditions and look at the term epistaxis, which is a nosebleed. Epistaxis, common name is nosebleed. It's hemorrhaging from the nose, and there are a number of different reasons a person may have epistaxis. The most common cause is trauma. Getting hit in the nose, whether someone else hits you or whether it's in a car accident. The most common cause of nosebleed is trauma. If no trauma has occurred, it's often just identified as being idiopathic, which means they don't know what the cause is. Sometimes when a person has sinusitis or cold, they may have some bleeding from the nose. Sometimes also a person that has high blood pressure, hypertension, may have some epistaxis. And the treatment is all about controlling the hemorrhage, applying pressure to control the hemorrhage. If that's not enough, the person may have to have bleeding controlled with what they call packing, and they literally pack gauze into the nose to allow it to clot, the blood clot. They may also have to perform cauterization of a vessel inside the nose. Also under etiology, there's a reference to some more severe underlying conditions, systemic conditions, that may result in the epistaxis. Like I said, that hypertension, congestive heart failure. Now with the hemophilia, the thrombocytopenia, and the leukemia, the person has some very serious underlying condition that's causing them not to form clots where they should. Like in hemophilia, these people don't form blood clots. And I'll talk about that in a later chapter. The thrombocytopenia, they do not have enough of the platelets to form clots. And also in leukemia, the number of thrombocytes are affected. Thrombocytes being the blood clotting cells, also called platelets. The tumors of the larynx. The only symptom of a tumor of the larynx will be dysphonia, which is difficulty with voice, which we commonly know as hoarseness. There's usually no other symptoms except the hoarseness. And if a person has hoarseness and it continues for weeks and doesn't go away, it needs to be evaluated because it could actually be a tumor that's formed on the vocal cord. There's a great picture in the book showing the comparison between a normal larynx, the true vocal cords, and abnormal vocal cords that have a polyp. Now, if it's a polyp, it's benign. The papillomas and polyps are benign tumors which usually occur because of overuse of vocal cords. Singers, for instance, often develop these polyps on their vocal cords. The malignant tumors on the vocal cords are certainly much more common in smokers and also common in people who have been exposed to secondhand smoke in closed quarters, like in an office situation. Certainly a biopsy must be performed to determine if the tumor is cancerous, which is malignant, or not. And then as far as treatment, if it's a papilloma or a polyp, excision is usually performed. The malignant tumors very often have to have radiation therapy to destroy those tumors, and may also have to have a laryngectomy. Depends on the stage of the cancer when it's identified what the treatment will be. Okay, we're going to skip a condition and then look at hemoptysis. And I really see hemoptysis not as a disease in itself, but as a symptom of some other disease. In hemoptysis, the person is coughing up or spitting blood from the respiratory tract. Could be an indication of trauma or some injury of the respiratory tract. Could be an indication of some erosion of a blood vessel in the respiratory tract, a tumor, tuberculosis. There are several different conditions that may cause hemoptysis, but the idea as far as treating hemoptysis is to determine the cause. And once the cause is determined, then the treatment will be according to the cause. This next condition, atelectasis, is also to me considered to be a sign of a condition, not necessarily a condition in itself, even though when we look at what it is, atelectasis, well, it is abnormal. It's an airless, collapsed condition of the lung. But for someone to have atelectasis, they usually have some underlying serious condition. Signs and symptoms: dyspnea, which is difficulty breathing, anxiety, cyanosis. Cyanosis is a bluish discoloration of skin. And the person may have this bluish discoloration because they're not able to breathe the oxygen in like they should because their lung is collapsed in atelectasis. The absent or diminished breath sounds: when a medical professional listens with a stethoscope and tells you to breathe deep, they're listening to the airflow in the lungs. And they can hear when those breath sounds are not present, which indicate the air's not moving through the lungs, which may be because of collapsed lungs. There may be some type of obstruction, a mucus plug, or a foreign body, somebody's inhaled, or a tumor may be formed in the lung that would cause the collapse. Also, a person who has had major surgery and they fail to deep breathe after that surgery may develop collapsed lungs. Collapse may be due to failure to deep breathe postoperatively or to prolonged inactivity. Now, after surgery, a person, especially abdominal surgery, let's go with that, abdominal or thoracic surgery, right after surgery, it hurts to deep breathe, and the person may fail to take in the air in and out like they should. Very often, the post-surgery patient will have a device that's going to help them to really practice deep breathing and coughing so that they can keep the air moving in and out of the lungs, prevent atelectasis. In infants, may be caused by prematurity, hyaline membrane disease, and narcotics that may pass over the placental barrier. Also, the baby may have an obstruction in the bronchus, causing this collapsed lung. Treatment depends on the cause. Incentive spirometry is that practice deep breathing where the person will use an instrument that's going to encourage them to breathe in deeply and breathe out thoroughly. Bronchodilators may be necessary, medications that dilate the bronchial tubes, or mechanical ventilation. Mechanical ventilation is being placed on a respirator. Again, the postoperative patients are at high risk for the atelectasis and encouraged to get up and move as soon as possible and to deep breathe after surgery. Oftentimes, the physical therapy assistants will be the personnel who help a patient to get up and start moving again soon after surgery. And then pulmonary embolism. First of all, what is an embolus? An embolus is any type of material that is any type of undissolved material, a mass, that is present in the bloodstream and it's moving through the bloodstream. The emboli, more than one emboli, may be little blood clots. They may be bits of tissue, like infectious tissue, clumps of bacteria, tumor cells, globules of fat, air bubbles, or something else that is in the venous system, that's in the veins and the vessels. And that embolus, that undissolved matter, moves through the bloodstream. And if that embolism travels to the tiny vessels in the pulmonary system, the embolism may have moved through larger vessels, but it gets lodged in an artery in the pulmonary circulation. Whatever this piece of material is, whether it's a blood clot or a piece of tissue, and it becomes lodged in a tiny artery, it's going to block that artery. It's going to cause occlusion of that artery. And when there's occlusion of the artery, then the person's not going to get the oxygen supply that they need. They're not going to get the blood supply that they need to that area. A small, uncomplicated embolism, pulmonary embolism, may cause the person to have coughing and chest pain and maybe run a low-grade fever. A larger embolism may cause an extensive infarction. Infarction is death of tissue. And if we're talking about a large embolism, a piece of matter in the pulmonary artery, and it's stopped in that artery and the blood will not flow past that point, the tissue of the lung begins to die. An extensive infarction causes dyspnea, which is difficulty breathing, tachypnea, fast breathing, chest pain, and causes a person to start coughing up blood, the hemoptysis. A massive embolism may actually lead to the person's death. In fact, the true symptoms of the embolism do not show up until it becomes lodged. And the symptoms will depend on which artery is actually blocked by this large embolism. Most of the emboli are actually blood clots. They're blood clots, and the clot has formed somewhere else in the body, in some other vessel. The most common predisposing factor for a pulmonary embolism, an embolism of the lung, is a thrombosis in the veins of the legs or the pelvis. A thrombosis is a blood clot. The thrombosis usually forms in a vein. The blood moves more slowly through veins than through the arteries. And the blood that's in the veins, because it's moving so slowly, may move so slow that it actually forms clots where it shouldn't, especially in people that don't move their legs much. Someone after surgery, for instance. Because if you remember about the anatomy of the circulatory system, you've got to use your own muscles to make the blood flow through the veins. If the person's not using their leg muscles, if they're laying in one place, they're very likely to develop a blood clot of the leg or the pelvis. And if that blood clot becomes dislodged from the leg or the pelvis vein, it's very likely to move right up the vena cava and actually make it through the heart, because those are larger chambers there. And then it moves the clot, the embolism, because it's moving through the vessels, moves into the pulmonary circulation where the vessels are very tiny, and that clot becomes lodged in a pulmonary vessel. I want you to read under etiology. Although most emboli are thrombi, they're blood clots, that have broken loose from deep veins in the legs or pelvis, emboli also may be composed of air, fat, globules, a piece of small tissue, and so forth. The mass moves through the venous circulation and is pumped by the right side of the heart into the pulmonary circulation, where it becomes lodged in a vessel. And they go on to give additional information: stasis of blood flow from immobility, like after surgery, injury to a vessel, any predisposition to clot formation, and they give some other examples. Even during pregnancy, a person is more likely to develop blood clots. A person taking birth control pills is more likely to develop blood clots. A person that smokes is more likely to develop blood clots. This is a time to caution a person who is actually caring for patients that may not be very mobile, like the physical therapy assistants or even the massage therapists. If it's your job to massage a person's legs or to help exercise their legs because they've been laying in bed for a long period of time, you must be very cautious, because if they have a blood clot in their leg and you massage it the wrong way or move it the wrong way, you may cause that clot to dislodge, and then it's an embolism because it's moving through the vessels, and it may move straight to the lungs and cause this pulmonary embolism. When we talk about the preventive measures are so important. Management of the risk factors that make a person more likely to develop clots, to encourage them to stop smoking, to be very cautious with those that are on birth control pills. Treatment for the actual pulmonary embolism is going to be about trying to get some oxygen therapy going so they have adequate ventilation, anticoagulant therapy to break up the clots such as heparin. There's also these TED stockings, thromboembolic disease stockings, that help a person to keep some pressure on the lower legs, to keep the blood moving up the legs through the veins so that clots are less likely to form. Okay, I'm going to stop here. So this is the end of part 1, chapter 9.